Dr. Bacon, I just want to talk briefly about the AstraZeneca vaccine. It is obviously not one of the approved vaccines here in the U.S., but Germany, France, Spain, and Italy actually all stopped using it because of some reports that people were developing blood clots after getting the vaccine. The World Health Organization does not seem worried about that. They are not advising any countries to stop using it. So I just wanted to clarify with you, what is the latest there? And do we have to worry about blood clotting with any of the vaccines that are approved here in the U.S.?
The latest evidence from Europe is that their equivalent to the FDA does not feel that these events are related to the vaccine. It's important to remember that in the general population, you are going to have a background rate of certain medical conditions, whether it's more common conditions like high blood pressure or diabetes, or more rare conditions like clotting disorders, which is what the concern was with the vaccine. What the scientists in Europe are trying to figure out is if the rate of those who are having clots or other disorders of the blood are somehow different from what we would expect in the general population. Right now, that doesn't seem to be the case. So overall, I would say that this is something we need to monitor. It's not something we need to worry about. There are going to be these coincidental not necessarily side effects, but coincidental conditions. And it's something that we need to monitor.
All right. And Diane MK wrote in. She was wondering if she would be clear to get surgery a week after having the vaccine, and she did not specify what kind of surgery.
This is, again, a question that I would direct to her primary care physician. But overall, getting the vaccine is not a reason to avoid getting surgery down the road. Now, if you're in between the two doses of the Pfizer and Moderna vaccine, you are not considered fully protected at that point. So it's likely that you will get tested for COVID-19 before going into surgery, but it's not a reason to avoid getting the vaccine or to delay getting the second dose of the vaccine.
Kelly Backaweaver wrote in saying that she heard that the vaccine side effects are actually proof that it's working. So was wondering, if you don't get any side effects, are you still building up good immunity?
It's very likely that you are still building up good immunity. The side effects are there, but they're rare, and it's felt that they are due to your immune system responding to the vaccine. But it's not necessary that you have side effects in order to show that your immune system is responding. Millions of people get vaccines every day. We give it to our children every day. In terms of other vaccines, we are trying to avoid side effects in those circumstances, and our immune system still responds. So I would not be worried about this.
All right. We had Terry write in wanting to know, if you've had COVID before and then recently got vaccinated, are you at greater risk of having side effects from the vaccine?
There is some evidence that those who have had COVID and get the vaccine may be a little bit more likely to get side effects. Again, this is not a reason to avoid getting the vaccine because the side effects are both rare and pretty mild overall, as well as being treatable with things like Tylenol or ibuprofen. There is some evidence that isn't definitive, but is coming out that those who have had COVID may only need one dose of the Pfizer and Moderna vaccines, but that has not been approved yet. So right now, if you get the Pfizer or Moderna vaccine and you've previously had COVID, you should still schedule your second shot whenever they ask you to.
Interesting to note, though, about the side effects for sure. All right. Well, finally today, Carolyn Brown wrote in wanting to know how long someone should wait to get the vaccine after they had an allergy shot.
Allergy shots are very specific to particular allergic reactions. So, for example, if you have a peanut allergy or if you have a pollen allergy shots are targeted against those specific allergies. I would certainly ask whoever is giving you the allergy shots whether they want you to wait for any duration. But to my knowledge, these are not a reason to delay getting the vaccine.
All right, Dr. Venkit, thank you so much as always. And if you at home have any questions for the doctor, let me know. You can message WTAE's Facebook page, or you can come directly to me through my Facebook page.